everyone, so let's move towards our today's topic, which is
the topic is norma frontalis. As the name indicate, norma frontalis, front ri, the word is front. Okay, front word ri, that means front view of the skull is called as norma frontalis. So bones which can be seen from the view of front, bones which can be seen from norma frontalis view are frontal bone, maxilla bone, mandible bone, zygomatic bone, nasal bone. आप सामने से किसी इंसान को देखते हो या किसी स्कल को देखते हो तो वहाँ पे आपको क्या क्या नज़र आता है? मैक्सिला बोन होती है, जाइगोमैटिक बोन होती है, फ्रंटल बोन होती है, मैंडिबल बोन होती है और नेजल बोन होती है. नेजल बोन फॉर्म्स द ब्रिज ऑफ द नोज. Okay, zygomatic bone forms the cheeks. Maxilla bone will form the maxilla bone is like के जहाँ cheeks होते हैं आपके, गाल जिसे उर्दू में कहते हैं, and mandible bone. And the mandible bone is like mandible bone वो होती है जो आपके लोअर जॉ बनाती है. मैक्सिला बोन आपके अपर जॉ और यानी मुस्टैश जहाँ पर होती है वो अपर जॉ वाला एरिया है और लोअर जॉ एरिया जो चिन का एरिया है वो एरिया मैंडिबल बोन बनाती है. नाउ ऑन द फ्रंटल बोन, नाउ नॉर्मा फ्रंटालिस we will study like frontal bone first. So on the forehead or on the frontal bone, superciliary arch are present, and on the frontal bone there are two superciliary arches, that is curved line are present. और बेसिकली ऑर्बिटल जो होते हैं ना, ऑर्बिटल ओपनिंग्स जहाँ पे आइज़ होती हैं उसके ऊपर बेसिकली एक कर्व शेप का स्ट्रक्चर होता है, कर्व शेप की लाइन होती है, सॉरी, and that line is called as superciliary arch, and in between that there is a point called as glabella. Okay, now on the upper part of the nose, obviously nose का एक aperture होता है, ठीक है. अब उस aperture के upper part में एक point होता है जहाँ पर connecting point होता है frontal bone और nasal bone का. Okay, and that connecting point having a suture called as frontonasal suture, and that point is called as nasion. Okay, nasion, Nasion. Okay, now like I said, there are two orbital openings on each side of the nasal opening, and that orbital openings are quadrangular in shape and having four margin. Number one, supraorbital margin, infraorbital margin, medial margin and lateral margin. Supraorbital margin is formed by frontal bone, infraorbital margin is formed by zygomatic bone, medial margin is formed by lacrimal crest, lacrimal bone you can also say, and lateral margin is formed by zygomatic bone as well as frontal bone. Now maxilla bone. Maxilla bone is another most important bone in the norma frontalis, and it is forming the upper jaw and the area where mustache is present. Basically वहाँ ये maxilla bone होती है, and it is also forming the nasal aperture for the nose opening, and there are two fossas, incisive fossa and canine fossa. Incisive fossa is present above the incisor tooth. Obviously you know that there are some teeth in our mouth. There are 32 teeth, and there are some names: premolar, molar, incisor, canine. So above incisor tooth there is a fossa called as incisor fossa, and above canine fossa there is a fossa, above canine tooth there is a fossa called canine fossa. Now like I said, maxilla is forming the upper jaw, and it is forming, as it is forming the upper jaw, it is also providing the socket for the teeth as well. Okay, now zygomatic bone, like I said, it is forming the cheeks and it is present below the orbital openings, and mandible bone is forming the lower jaw or the area where chin is present, so it is also providing the socket for teeth. Okay, now what are the foramen we can see from the norma frontalis view? Number one is supraorbital foramen. As the name indicates, it is present in the supraorbital region, that is above the orbital opening. There is a foramen called as supraorbital foramen for supraorbital vessels and nerve. Now, infraorbital foramen, as the name indicates, below the orbital opening, there is a foramen called infraorbital foramen, and it is present in the zygomatic bone. Whereas supraorbital foramen is present in the frontal bone, and infraorbital foramen is present in the zygomatic bone. Infraorbital foramen is basically for the from which nerves are passing, infraorbital nerve vessels are passing, and last one is mental foramen, which is present in the mandible bone, and these three are present basically in the same plane, okay, in same line, and through these there is a nerve which is transmitting, that is trigeminal nerve. There are three branches of the trigeminal nerve which are passing from these three foramen. So this is the most important point you have to remember कि ट्राइजेमिनल नर्व की जो तीन ब्रांचेज हैं वो इन तीन फोरामेन के थ्रू पास होकर स्कल में आती हैं, दैट इज सुप्राऑर्बिटल फोरामेन, इंफ्राऑर्बिटल फोरामेन एंड मेंटल फोरामेन. So take care of yourself and good luck, work hard, study hard, and good luck. Bye, thank you.